Had a lady want me to smell her boob to see if it smelled yeasty. Ew! Hey guys, welcome to Nurse Talk. My name is Mia. Today we're going to be reacting to a nursing Reddit thread called Tell Me About Some of Your Most Ridiculous Patient Requests. So let's get right into it. Okay, first one. A&O, so alert and oriented, walkie-talkie means the person is completely independent, says, I could really go for a back scratch right now. Me, short-staffed with 6 other patients, holds eye contact and silence for about 5 seconds before replying, you know what? Me too. Then walks out of the room. Okay, this is kind of a long one. I had a patient, early 30s female, who was unfortunately paraplegic, but completely A&O, so alert and oriented, asked me once to check on her every 5 to 10 minutes. I'll set my timer. This was overnight, and I had 5 other patients. She was monitored, and when I pointed this out, she said, it's not the same. We had what I felt was a productive discussion about realistic expectations, and when I pointed out she'd never sleep with a timer going off every 5 minutes, she agreed that it probably wasn't a good idea and that she'd call me when she needed me, and I'd round on her as frequently as I could. All night, she was on the call bell with silly requests. I want a milkshake, and my pillows aren't fluffed enough. And who can I talk to about the Wi-Fi? At one point, she asked if I could order her a pizza and then leave the hospital to go pick it up because she didn't like the local delivery options. When I told her that this wasn't possible, she started crying. I walked out of the room every time she made a request like this, usually saying something like, I'm sorry, but you know that this is an impossible request. Please only call if it's an emergency. And she'd be on the call bell within seconds, wailing, you abandoned me. Please come back. This is patient abandonment. Our charge nurse went in to speak with her several times, and the AOD spoke with her twice. She was so ridiculous. The next morning, she lodged a formal complaint with management about our cruel mistreatment. Our A&M emailed me and said she, the patient, made a pretty convincing case, crying and stating we never checked on her, we were rude, etc. Until she, the A&M, was walking out of the room, the patient said, by the way, I have some massage oil and CBD vape in my bag. Could you please give me a massage? And I'll hit my vape pen to calm myself. Talking about this experience really triggered me. I don't think people understand that you have 5 to 6 patients. That patient would have to be a one-to-one to fulfill all of those requests, and you probably still couldn't satisfy her. Some people can't be satisfied. Someone commented, oh man, I work on a specialized acute spinal cord injury care unit, and I cannot even begin to tell you how common this type of attitude is from paras and quads. It's either this, the most evil and straight up verbally abusive men you've ever met, who are blacklisted from every group home in the area, or the sweetest, most inspiring person you'll ever meet. There's no in between. The psychological effects of spinal cord injury are so interesting to me. Witnessing how different people handle the same devastating trauma in wildly different ways is something for sure. Someone also commented, I felt all of this. I work in acute rehab and we have these patients for 4, 6, 8 weeks sometimes, longer if they have no placement. It's so exhausting. Usually people like this are one and done. If you're back the next day, it's someone else's turn. Okay, next one. Had a patient request a prescription to not see his girlfriend because she raised his blood pressure. The most confused I've ever seen a doctor. Someone commented, we had a guy request to have his mom formally blocked from all communication about him. Made him confidential. Imagine his reaction when I showed him the block function on his phone. Guys, if someone stresses you out that much, you gotta tell them. Okay, next one. When I was an ER tech, we had a patient with working arms but just needed minor assistance to use the bedside commode. When she was finished, I gave her some warmed hygiene wipes that she could use, in which she replied, isn't that, while wiping her ass, your job? LOL. I was just amazed that someone that was fully capable would even want me to do that. Nah, actually, that's only patients that aren't physically capable of self-care, or something along those lines was my reply. Someone commented, at least she used the commode. I've literally had patients purposefully soil themselves because they believed it was our job to clean them up. Someone commented, I'm an RT, but had a lady who was overweight piss herself in the chair because she said no one would come get her from the chair to take her to the bathroom. She was fat, but fully able to stand up and walk herself over. I'd say she was obese, but not like 600 pounds life obese, just a chunky mama. This person's funny. Okay. But she thought someone was going to carry her to the toilet every time. What? Why would someone carry you? It was the laziest thing I've ever heard. Like, how can you, a grown working adult, sit there, piss all over yourself because you think someone is going to come and get you, carry you over when you're fully capable of walking yourself? Oh my God. Someone commented, ah, yes, the wee old weaponized incontinence. It's a tie between I'm too comfortable in my bed to get up when I'm very much physically able, or it's your job, take care of this. What in the hell? Okay. Someone also commented, I also have a patient that told me to wipe their ass because it's my job to do it. She was A&O and elderly, but capable of doing it. She refuses to get up on the commode and told me that she will lie down on the bed with a dirty ass. I told her who would help you when you get home. She said, I'll call my son. I told her, you would call your son in the middle of the night to wipe you? She threw the wipes at me and lied down on the bed with a dirty bum. I'm like, okay, whatever. I called the RN. RN was telling the patient that she needs to do it herself for independence and be ready for discharge. She said that she has a lot of comorbidities and she said she's unable to reach her back, as she demonstrated, completely able to reach her bum while doing the wiping motion. The RN and I told her that she demonstrated well that she could do it. Still refusing to do so, the RN told me she'll deal with her. I don't know what happened after that. Oh my gosh. Wipe your own butt. What happened to privacy? Someone commented, $1 million and a whiskey on the rocks. Said by every single middle aged man I asked if there's anything else they need. And honestly, I still laugh because it's cute and harmless, and we need more dad jokes in the world. Someone responded, I get that response too. I can't bring myself to laugh, but I respond, Sir, if I had that, I would not be here. And they usually laugh. Someone also commented, no matter how many times I've heard it, I always laugh and say, you and me both. I'll gladly take a repetitive dad joke over most of the BS I hear regularly. Me too. No harm in a little dad joke. Okay, next one. Point at oranges. Make squeezing gesture. Thumbs up. Language barrier, my ass. Yeah, they wanted you to squeeze them some fresh orange juice. Unfortunately, we do not have the time to squeeze you fresh orange juice. You can get the pre-made orange juice in the fridge like everyone else. Or you can squeeze your own oranges. Okay, next one. I had a patient demand melon for swallowing pills. He said he never drank any fluid, and all the water he took in was through melons. He literally took no oral pills or fluid during his stay because of this. I wonder how much melon you would have to eat in order to get like your 2 liters a day. That'd be a lot of melon. Had wife of a patient ask me for oil or lube as they had run out. Patient had severe stroke, but apparently his genital regions worked fine. For a couple in their 70s, it was so extensive we were discussing if we needed to intervene, as he needed rest at some point. We did, and his argument was, well, she does all the work, I don't mind. I will get a lot of sleep when I die. I will admit, giving him a fist pump, he clearly had his priorities straight. It'd be very amusing. Okay, next one. Patient didn't like her recliner. Fine, swapped it out for one in another room. Didn't like that recliner. Refused to get into bed. Demanded I call the hospital carpenter to come fix the recliners so that they would be more comfortable for her, not to mention it was 3 a.m. Okay, just so you know, hospitals don't have carpenters. They order thousands of recliners at once, and they fill them in the rooms, and maintenance sometimes will fix them. If not, they're put into some like empty room where broken stuff goes, and they're all the same. Next one. We had a patient come to our ED because she shit herself and wanted us to clean her up. A&O times 4 and completely capable of doing it herself at home. Oh my God.
Weird.
I don't understand. It's really odd how you would ever want to even go in public if you shit yourself and you could clean it up yourself. That is really weird. Did you sit in your car chair with a dirty butt and drive all the way there and dirty your car and walk outside into the ED with a dirty butt? That is so weird. Just get in the shower. Oh my God. Someone commented, disgusting abuse of the ED. I hope they told her to get the fuck out. Hopefully they did. Oh, someone commented, what did the patient normally do when they had a BM? Did she drive herself there in dirty underwear and then wear the same underwear home, only to have come back because she got dirty again? Did she have no arms? So many questions. The person who made the original comment said, we have one coworker who, despite her 20 years of nursing, is still an angel of a human. She did, in fact, clean her up and sent her on her way. That woman has more love and patience for people than I thought possible. I don't know. Someone commented, is this like a fetish, mental illness? What the hell? People are disgusting. I agree. Why? This is like our third wipe my butt story. So it is kind of feeling like a fetish of some type. That's really creepy and weird. I can't think of anything worse. I literally can't. Of pooping myself and then having someone else clean it up. How demoralizing. And people are literally going to the hospital for that. That is so odd. Okay, next one. In the ICU, patient put on the call light, and when I got in the room, he said he was having a massage emergency. I thought he was kidding. He was not. He wanted a stat back massage in the ICU. Next one. Had a patient use their code alarm as a room service button. Patient, I'm just not feeling the vibe today. Could you get my lunch tray and bring it to my room? Me, absolutely the fuck not. You are ambulatory and you will get your own tray. That is not a room service button and this is not a hotel. Don't do that again. And I walked away. Good for you. Good for you. That one has 73 upvotes, and I'm going to upvote it because I agree. Boundaries. Sometimes we have to be clear and kind of standoffish and a tad rude back. Just a little bit. Okay, next one. I have a few. Okay, so they gave us bullet points of certain requests. Fresh cut mangoes, fresh cut strawberries, smoothie with oat milk, wash my face, A&O, and functioning arms. Hold my urinal, again, functioning person. I've gotten that one. Disgusting. Absolutely not. Back massage and foot massage. For reference, I work in Canada, and the most I can give you is some cookies and cheese. Healthcare is free, but not a luxury hotel. Next one. I'd call it weird more than ridiculous. 1 prune juice mixed with 1 apple juice and 2 butters microwaved for bowel care. Someone commented, that's the nursing home constipation cocktail. It is, and I've actually made that concoction before, and it works. Use it if you'd like. Okay, next one. Call light goes off. Patient in contact room. I get geared up, and once I'm in there, she waves at her bedside table and says, get rid of the trash. There's an empty orange juice container and a graham cracker wrapper on it. There's also a trash can next to her. This was the 700th time that she had called. Some of her other requests: coffee, snacks, bathroom, warm blanket, ice chips, water, turn the thermostat up, turn the thermostat down, take her socks off, put her socks on. Every single item was requested separately, and she'd repeat them. She's also entitled, rude, and downright mean on occasion. I'm on a busy med-surg unit with people needing IV meds, but this lady would start yelling if we don't tend to her immediately. It was a long shift, and it's also what pushed me to look for another job. Yeah, it would take me like 10 requests before I was like, go ahead and yell. I'll be in the other room. Okay, next one. Actually, it was just last night. Patient rings. Patient is an elderly female who is able-bodied but morbidly obese. I go to see what she needs, and she says, I can't sleep because my butt crack is itchy. I say, well, you should probably scratch it. She states, I can't reach it. I ponder this point for a moment and say, I'm not going to scratch your ass crack for you. That's so gross. Okay, next one. What? I had a patient who wanted me to stand behind him while he was on his side and hold his ass open while he shit. His mom did it at home. He was assist times two to the commode, but insisted we do this for him. He was 40 something. Ew. Someone commented, long-term care rehab is wild. I will never go back. I think I fell for it once because I thought maybe he needed a little help getting it out. No, he was fine, and eventually, once we had all refused, he quit asking. Thank God. Between taking the poop and cleaning yourself up, that is the most intimate, disgusting part of life, and you want someone to witness it? Okay. Okay, next one. Had a lady want me to smell her boob to see if it smelled yeasty. Ew! Oh my God. She did not like it when I said no and gave her discharge paperwork and told her it's time to go. Someone commented, I'm a teacher who considered nursing a couple of times. Whenever I've had a bad day or week at work, I come on here, read this kind of stuff, and think I could have had it so much worse. Someone just commented, pubic haircut. Okay, someone commented, oh my God, we had a guy request this, and we were like, no. Then someone gave him some clippers, and he shaved his gigantic afro off his and threw it on the ground. To be honest, though, I kind of wish it was acceptable to landscape some of these people because trying to rake poo out of a 4-inch bush is the worst. Ew. Someone someone commented, I've had to cut a dried up dingleberry out of someone's butt hair once. So nice. That's so gross. Someone commented, confused patient with a Foley wanted it out. And I was like, no, I can't do that. It's a medical device, needs to stay in. Then he gestured to his pubes and was like, what about these? And I was like, what about them? And he goes, can't you cut them off? And I was like, no, we don't do that sort of thing here. And he muttered under his breath sarcastically, we don't do this sort of thing here. Next one. During the deep of COVID times, obnoxious family member kept calling in. Family member was primed, paralyzed, etc. Asked us to remove their breathing tube so they could talk for a little while and then put it back in. Would not understand that the patient would die. Oh my God. It's not a hard concept, but you'd be surprised. All right, next one. Patient's daughter asked one of the residents to put in a nursing communication order to rub her father's feet every 2 hours PRN. Someone commented, well, I'm glad they were reasonable enough to not ask for every 2 hours scheduled. Okay, next one. I had someone ask me once to come to court to testify in his disability hearing. I firmly declined. We had a known gang member, an IV drug user, ask if we could leave his central line in because his veins were shit, and he could use it for his heroin fix. I laughed and said I'd get the doc to order that right away. He said, appreciate you. Okay, next one. A woman asked me once to move her purse from the right side of the bed that she was laying in to the left. She came in fully independent at home and was in for a broken ankle. Her arms worked fine. Okay, next one. Can you disimpact me? Patient had an established ileostomy but was requesting anal disimpaction. Ew. Gross. Okay, next one. Just the other week, a guy asked to switch rooms because he said he had a view in the current one. For some reason, Charge agreed to move him. Then he complained The bed in the new room wasn't as comfortable. They moved him again, and after he claimed there was a roach, no one saw one, he also complained the blanket from the warmer wasn't warm enough, and the texture wasn't the same as the first one. They were literally the same. It was like dealing with Goldilocks. Next one. Any chance you could get a slice of lemon for my water pitcher? Okay, next one. Patient with working hands asked me to remove her contact lenses. Why would you want someone else's fingers in your eyes? Oh my God. Okay, next one. If you give me Phenergan and Benadryl first, you can slam my dilaudid. Sure, we'll get right on that. One of my coworkers had her elective hip patient request that she brush her teeth for her. She was being discharged later that day. Okay, next one. Not my patient, but in the PICU, we had a patient's parent hit the call bell and want their nurse to pat the baby to sleep. No reason baby couldn't be held, and they were holding the baby earlier. It was that this mom thought all parenting responsibilities flew out the window and the nurses needed to do everything. Nope, if you're in the room, you're doing it. Okay, next one. Had a patient that wanted taco sauce. Not he wanted me to order it though. He wanted it made by me. He wrote down a recipe and started to tell me how to make it with tomato paste, water, paprika, fresh cut chilies. No way. You think we have time for this stuff? Next one. I work in pediatrics and a mom wanted me to fill out college admission paperwork for her son, the patient, who was starting college the following week. She said she was too busy to do it, and since I knew all of his medical history, it'd be easier for me to do it. I did not fill out that paperwork. Good, don't. Okay, next one. I was working in patient psych, sitting at the desk when a patient came up to me and told me, and I quote, a poisonous spirit lizard had bitten me in the ass. I looked him straight in the eyes and said, I hope you don't expect me to suck the poison out. He laughed and went back to bed. What the hell? You'll have some very interesting interactions in the psych ward, that's for sure. Okay, next one. Had a patient straight up try to unalive himself in code because we couldn't get them baby back ribs. Okay, next one. Paint patient's toenails, asked by her daughter. I laughed and walked out of the room. Okay, next one. Asking for water immediately before surgery, which is a normal request that we get often. However, most people can take no for an answer once I explain why they can't have any. Well, this patient decided my answer was wrong and that other hospitals let them drink glasses of water and pre-op, so they wrote a letter to the hospital administrators naming me as an incompetent nurse who wouldn't give them water. I mean, we could give you water and then you could possibly die. Okay, next comment. Honestly, the craziest requests seem to come from patient families like, I can't eat any of this food. Can you run to McDonald's for me? No, I'm caring for patients. You can get Uber Eats or something, but I am not leaving my patients to go on a family McDonald's trip. Would you leave your work to go get someone food? My God. Okay, next one. One of my coworkers told me a patient asked him to hold his hands while he shat. I still can't believe he did it. Okay, next one. You have to stay in the room and watch me brush my teeth or I'll choke on the water. This is after he fed himself a regular breakfast tray and downed a large Diet Coke. Aw, he just needs some attention. Okay, next. I once had a patient request all their meds be American made. Wow, okay. Next one. That their emotional support person be allowed to stay past visiting hours or they're going AMA. I've heard this several times in the last couple months. It must be on social media somewhere. Okay, next one. Family demanded nurses check on patient every 15 minutes. They specified and demanded to know our ratios because it wasn't happening and wanted to know where they needed to go to ensure appropriate care. There were easily 10 family members in the room with the patient at any given time, and we were on a busy med-surg floor. I told them we round hourly, and we have 5 to 6 patients to each nurse. Q15 checks are ICU, not here, so be thankful I'm not in your room that often. And people want to wonder why there's a nursing shortage. There isn't a nursing shortage. There's a shortage of nurses who want to work bedside. That's it. Okay, next comment. Oh my gosh, the other day my constipated elderly patient was yelling at me and demanding that I give him that grease off the counter and some gloves so that he could put more in his butt. It was lube that the doctor used in an attempt to manually disinfect him. I was like, no, absolutely not. The weird obsession the elderly have with pooping amazes me. Well, it is really uncomfortable when you can't poop, so I'll give him that. Okay, last one. I was drowning one day and my patient wanted me to get him Starbucks. There was one in our hospital, but it was a bit of a walk and always a long line. Sorry, I'm busy right now, and it's time to do our dressing change. He said, okay, can you go find somebody to get me Starbucks while you change my dressing? No, your CNA is busy changing someone. He rattled off a couple of other nurses' names. I said Starbucks is a long way from the unit and people are working and busy right now. We are not able to get you Starbucks, but feel free to ask a family member to bring it to you. I couldn't believe how he kept harassing me to get him Starbucks. And no, I'm not sending my CNA, and no, I'm not asking my coworkers who are also busy to get your Starbucks. What the hell? All right, guys, that'll be it for today's video. Thank you so much for watching. Nurse Talk will be taking a 2-week break for the holidays. I hope you guys have a Merry Christmas and a Happy New Year. I shall see you next year. Bye, guys.